Thank you for joining us today for our first Lunch and Learn for Youth Hope Month 2025. I anticipate many are familiar with Youth Homeless Outreach Prevention and Education Month and have participated for years. If so, thank you and welcome back. If you're a new partner for Youth Hope Month or new to the Lunch and Learn series, welcome. I'm Amanda Whitlock, the CEO for the National Runaway Safeline, and I thank you all for joining us today. NRS was founded in 1971 and strives to keep America's runaway, homeless, and at-risk youth safe and off the streets. We provide crisis and information hotline services 24 hours a day, 7 days a week to youth and families, offer prevention tools, educational resource, and collaborate with partners to raise awareness of youth homelessness. Youth Hope Month has 3 goals. The campaign is a national campaign that is achieved through the support of the Family and Youth Service Bureau and hundreds of partners and organizations and individuals nationwide. The goal of Youth Hope Month is to raise awareness of youth homelessness and the importance of preventing and reducing factors contributing to runaway incidents and youth homelessness, educate the public about how local communities and systems of care can work together to address youth homelessness, and increase visibility of available services and resources for youth in crisis. As part of those educational goals, we're gathered today to highlight a collaborative and innovative response to youth homelessness in Illinois, a program called CCBYS, which stands for Comprehensive Community-Based Youth Services. This program is the result of a partnership with IDHS, ICOY, which is the Illinois Collaboration on Youth, National Runaway Safeline, and statewide partners across the state. I thank all of the CCBYS program representatives who are part of the formal presentation and are listed here, and those in the audience for joining us today to highlight the CCBYS program. Our goal in our time together is to spend about 45 minutes highlighting how CCBYS responds to meet the needs of runaway and homeless youth in Illinois, leaving 10 minutes for questions and answers. So thanks, Andi, for joining us today and kicking us off with some history about CCBYS.
Thank you, Amanda. I'm so glad to be here and for having us and highlighting the CCBYS program, which if you're finding that a clunky mouthful, just know that we do too. We've been joking for years that it's kind of a lot to say for a program name, but if you are not familiar with CCBYS, it started over 40 years ago, back to ensure that young people who were status offenders were not blended together in, jails and detention centers and things with other people who were actually experiencing delinquent or criminal behaviors. And if you aren't familiar with that term status offenders, let me just describe for you what that means. That's things that are against the law because of a person's status or age generally. So things like being a runaway, being homeless, being truant from school, drinking underage, violating curfew, all those kinds of things would be considered status offenses because they're not illegal for adults to do. They are generally, though, in lots of places, not permitted for children or youth. So back in the 70s and 80s, in Illinois, we were thinking about how do we get kids who are experiencing these challenges. They shouldn't really be like locking them up, incarcerating them, charging them with offenses really wasn't solving the problem of what is making someone truant, what is making someone run away, what is behind the reason that someone would be violating curfews or things like that. And so the thinking at the time, which we very much still share, is that the solution here is not to lock people up, but to connect them to services and try to get to the deeper, issues of what's going on with the young person, what's going on in their family, what's going on in their community or their school, to try to figure out, how can we solve this problem instead of just putting people in jail. So, and we also, in that case, we're trying to make sure that people did not go into both or either the juvenile justice system or the foster care system for these kinds of behaviors. So specifically, now CCBYS serves young people ages 11 to 17. There's a possibility, given certain circumstances, that kids as young as 10 can be served as well. And they generally have a very high risk of involvement in the foster care or juvenile justice system. You might call the foster care system the child welfare system also. So these would be kids who have run away from home, they are out of control of their parents, or they are locked out of their homes. Like, so maybe they got picked up by the police and the parents refuse to pick them up again, or they're in a psychiatric hospital or in an emergency room or something like that, and parents refuse to pick them up. So those we call lockouts here in Illinois. You might have other terms for them. I know we'll get more into the eligibility later, but this is just sort of a real general quick history of how the program came to be. And when we passed the legislation, and you can see here the statute, when we passed the legislation for this, we set up a designated provider for every single community in the state of Illinois. So every single community has every provider has a region, and I think we'll show some maps later on too. But you'll be able to see that there's every community is covered, and we'll get into how exactly that program works. So I think the next slide, thank you. Oh, you've already got me. So the goals here are to increase family reunification, preserve and stabilize families whenever possible, as I said, divert young people from the child welfare or foster care systems or the juvenile justice system, make sure that young people are safe, and we help them develop a crisis stabilization plan, and then connect them with resources and supports in their community. So I'm going to hand it off to my colleague Seth, who's going to kind of go through what that community level response and system of care is.
Thanks, Andy. I appreciate it. As Andy mentioned, the goal of the CCBYS programs are accomplished by our partnerships with a network of 28 agencies that provide coverage throughout the state. So here's kind of the map of our coverage. And as you can see, there's a provider in every local area across Illinois. Chicago is a lot more dense, right? So it's got kind of its own map as well as Cook County. But this is kind of an example for you all to be able to view exactly how these agencies provide their support by location in the state. So this partnership between ICOY, National Runaway Safeline, and DHS, we work to ensure that youth who are at risk of homelessness in Illinois have an identified service provider that can assist, regardless of the community that they're in. It doesn't mean that all the services look the same, right? We know that issues in rural areas and urban areas are different. And so those community providers have expertise in those spaces. And so they have different approaches and supports for their communities. Next slide. So from July of 2023 to June of 2024, CCBYS has served nearly 6,000 youth. The average length of stay in the CCBYS program was about 98 days. 3,235 nights of placement were provided to 373 youth at an average of about 8.67 nights per youth. I'm going to pass it to Cheris and Brad, and they're going to walk you through a case and how a youth or guardian interacts with the CCBYS system.
Great, thank you, Seth. As Seth mentioned, there's some differences based on geography, but Brad and I are going to describe what happens from first contact to the information or referral line to stabilization resources. As mentioned before, I work with Project Oz, and we provide coverage in 2 counties in Illinois, McLean County, which is actually the largest county by land area, and Livingston County.
Okay, thanks, Cheris. So when a caller contacts the IRL or Information and Referral Line, now the caller can be the youth themselves, a parent or caregiver, law enforcement, hospital staff, school personnel, other social service agencies. When a caller contacts the IRL run by NRS, we gather some basic information to determine the correct CCBYS referral. So these calls are usually brief. They're 5.5 minutes on average. We collect the youth's name, their age, their gender, their current location, and just a brief summary of what the crisis is that they're in. We also collect the caller's name, their relation to the youth, if they're with an agency, that information. We then use the youth's current location to determine which CCBYS agency to refer the caller to. So most agencies either have a 24-hour number that someone can reach out to them with, or they have a Monday through Friday daytime hours number and an after hours number to call for crisis intervention. And if needed, we can also connect the caller directly to the CCBYS agency. So that's kind of a summary of what these calls are like, these initial calls. So now I'll pass it on to Cheris, who'll say a little bit more about the initial response and the screening process.
All right, thanks, Brad. So initially in crisis situations, CCBYS staff must respond in person and conduct a face-to-face intervention within 60 minutes in urban or suburban areas or 90 minutes in rural areas. So from there, most of our face-to-face interventions occur at basically neutral locations. So a lot of times law enforcement, so police stations, fire stations, which are licensed safe places, schools, hospitals, someplace that's going to be a safe, neutral location. CCBYS staff mediate the situation and attempt to facilitate family reunification because I think, as Andi mentioned earlier, our goals are to divert young people from the child welfare and juvenile justice systems. And so our goal is always family reunification, if feasible and if safe. If this is not immediately possible, CCBYS staff will then help locate a temporary placement option for the young person. While the youth is in placement, CCBYS staff will offer support and attempt to stabilize the youth and work toward family reunification. So, at that point, we have to screen that young person. We conduct a crisis, a safety screen with the young person and the family. That's what we're all doing, even prior to that mediation. A lot of times this kind of happens back and forth. Sometimes we'll do a safety screen with the young person. The family may not be there yet. And so then we have to go back and do kind of that mediation. We do what we can in the moment, just kind of recognizing the needs of young people. And then just try to figure out what is going to be the best situation. And so, you have a typical young person who comes in to a police station, to a hospital, and this young person is scared to return home, or they're having some conflict at home and they just don't know what to do. And so they've run away from home, and oftentimes we realize that young people are simply running from a situation. They're not necessarily running to their best friend's house or to trying to go to a party or something like that. They're running from a situation. They're running because they feel unsafe, unheard. And oftentimes a lot of it just has to do with communication and families just not having the information that they need to best support their young person. And so young person comes through and we connect with different resources and different systems of care. And so every situation is different. And so a lot of these systems of care that we're connecting with, it could be mental health services, medical services, child welfare. Even though we try to keep young people out of the child welfare and juvenile justice system, there's still there's still connections with those systems because we understand that we need to work with those systems in order to provide the best wraparound support for our young people. And so as we highlighted in our example, youth enter the system through the IRL, which is the information referral line, connected to a CCBYS provider. And CCBYS then works to ensure that youth are connected with any providers within that existing system of care in the youth area. Job trading schools, that's a big one as well. Just knowing that a lot of young people, a lot of their conflict doesn't stop at home. It spills over into the schools as well, just because it's the place that they spend the majority of their time. And so being able to connect them with all those resources and provide a wraparound approach is what CCBYS does best. And so like we said, system of care may look different for each youth as we work to individualize their services. So I'll pass back to Seth to talk about data.
Thanks, Cheris. Thanks, Brad, for kind of painting a picture of kind of one example of youth in crisis. As we know, crisis looks different across the board. So there are many other potential ways that a young person would become involved with CCBYS. This slide identifies the two categories of youth that CCBYS is designed to help with. Youth in crisis and youth not in crisis. What you can see is in 2024, 30% of the youth served by CCBYS were crisis youth. Of those, 50% were runaways, 30% were lockouts, and 12% were considered beyond parental control. 69% of the youth served by CCBYS were youth who were at risk of crisis, and CCBYS engaged to actually help prevent that youth from running away or a lockout. Next slide. Remembering that CCBYS exists, again, to divert youth from restrictive settings. We're pleased to note that in 2024, only 2% of youth were in a secure setting or DCFS care at case closure. 88% were in a family or long-term living arrangement, and that's a very positive data set. Next slide, please. I'm not going to go through all of the educational outcomes, but we all know that a youth's engagement with the education system is connected to friends, community, and adults that can keep the youth safe, kind of this holistic model. So 86% of the youth were attending school or alternative education programs, and average about 50% of the youth with suspensions, truancy, or expulsion, and improved in their academic outcomes as a result of being a part of this program. Even if a youth goes to school, there's still many variables that can distract them from their ability to do well, even within a school day. We know the challenges that youth are facing outside of those few hours that they're in school. So this program works to address those. Next slide. To sum up the impact, CCBYS providers spent $27 million to serve 6,000 youth at an average of a cost of about $4,733 per youth. If you remember our initial numbers of 98 days, for the average case opening, that's a large amount of savings, keeping that money versus, putting it into juvenile delinquency, juvenile justice programs. So yeah, definitely this program works on a fiscal level as well as a moral level. So I'm going to pass it back to Andi to lead our last section regarding lessons learned.
Thank you, Seth. So if you're thinking about, what should you do if you wanted to try to stand up a system like this in your community? I'll say that the first thing, what we learned here was that we hope that while you can duplicate those things, you've got to have some of these issues covered. So we really want to cover some of the lessons learned that we've all come to know over the last 40 years. So the first one is that we need legal authority to respond and to support action. So as you know, as we mentioned, and we included earlier in this slide deck, there's an actual statute. And remember, like if you're meeting a child at 2 a.m. in a police station or something like that, you've got to have the legal authority to take temporary custody of them, like to put them in your car and drive them somewhere and, things like that. So you've got to have that legal authority clarified that this is something that you and your team are able to do. So I think it's really important to make sure that whether it's your somewhere in your child protection statutes or your juvenile court act statutes or other places where in your community where this work might be governed, you want to make sure that you have those things covered in your statutes. And certainly you can reference the one that we have here in Illinois as an example. And then Brad, I think you're getting the next one. Lesson learned here.
One moment, please.
Oh, sure.
Okay, sorry about that. So another lesson that we learned is about history. So I've been working with CCBYS for about 15 years in different capacities. So all of us on this call, we've really learned about the program, about turnover in the program, and we recommend that the more you can document what is happening and why it's happening, that will help. Also documenting the changes and why and how this can help us better understand all that we have. Sorry, about where we've come from and where we can go to better the program and to adapt going forward. So I will now hand it over to Cheris.
Great, thanks. That's so true. We've also learned the importance of respecting and relying on partner expertise and allowing for unique and regional adaptations. Because for Project Oz, we serve Central Illinois, which is far different than Chicagoland, downstate Illinois. And so we know our communities and what they need. And so if I were to try to implement some of what we do for more of the rural communities up in Chicago, it just wouldn't land the same. And so just knowing what your expertise is, but then also having those great partnerships with others. The CCBYS program trusts us to be responsive to our community needs and to tailor our approach at all times. And this is crucial to ensure that families in every community feel safe and supported to engage with the program. And our community partners also feel safe, and they also know that we have tailored our approach to work with our young people, our families, especially our rural families who may not have some of the same services that some of our suburban and urban areas do. And so that is just a huge piece of really relying on partner expertise. Seth?
Sorry, I'm gonna unmute. I think one of the biggest things that we've learned at ICOY has been engaging partnerships across the state in spaces where they can learn from each other as well. So one of the challenges that we're seeing is that although youth serving organizations in rural spaces have their own kind of systems of working with those young people and the challenges that they're facing, they can also develop and learn from organizations that are working in urban communities and dealing with the challenges that they are facing. So as we can get compartmentalized in how we serve young people and how we provide these supports. And that compartmentalization can be a challenge in how we work directly with supporting these youth in crisis. So being able to say, I know that these folks over here are in a rural community, but man, they've got some really good responses to situations that may be a little bit similar to us. And they've created something that works. We're going to adopt that over here in the city, and vice versa. Kind of bridging those gaps that are kind of created by a kind of the blinders that we can put on as we are doing our work. I would definitely say that that's kind of the major thing that we've learned at ICOY. We'll pass it back.
Great. Thanks, everyone. We are ahead of time, which I think will allow us the opportunity for people to put questions and answers in the chat, but we can also turn off presenter mode so that we can have more of a conversation. So if you aren't camera ready, here's your warning to get camera ready because we're about to switch formats. And if your camera's on, we're about to be able to, you'll be viewable to everybody, and just raise your hand or put that question in the chat. And our hope is that we can have a conversation about any areas of this program that you may want some more information about. So let's make that switch. And I will stop sharing.
So I've been around the CCBYS program for more than 30 years. And I'll say that one thing that I think is really important and special about this is that it is completely statewide. So because, you know, kids don't, they don't always say, oh, I've crossed the county lines. I can't be served, or, you know what I'm saying? Like, so there's lots of intra provider communication too. So like, Cheris, I don't know if you want to ever talk about like what happens if you get a child from, you know, you guys end up picking up a kid who actually lives, you know, a couple counties over, or maybe even from out of state. Like, how do we handle those things?
Yeah, absolutely. So the great thing about the CCBYS program is that we work so well with our partners throughout the state, and we all kind of know what it is that we're expected to do, and then what our expectations are of the other agencies. So as I mentioned, we're right in the central part of the state. And so if a young person arrives at Project Oz or at, picked up by law enforcement from another county that we may not serve, but is in our county currently, we'll still respond to that young person because they're in our current location. And so at that point, we offer the same crisis intervention services. We do the same safety screen. We try to understand what the situation is. But at that point, and we contact family, guardian, all of that. At that point, once we realize that they're out of our service area, we will contact, oftentimes through the IRL line, the other CCBYS agency, because we either we automatically know who the other CCBYS agency just from awareness, or we'll contact the IRL line and say, hey, here's the young person that we have. Their home address is fill in the blank, and the IRL line will let us know who that is. And then they'll connect us with that service provider. And then we'll connect with that service provider, and we'll arrange a meeting place, oftentimes halfway. And then at that point, they'll take over the intervention. One of the things, though, that's great too is, if it's 2 a.m. and we have a young person in our custody because of a crisis and they're from another community, we're not going to expect the other CCBYS agency to meet us at 2 a.m. It's not good for our workers. It's not good for the young person. And a lot of times we need to consider what's best for that youth in crisis at that time. And what's best is someplace to sleep and someplace safe to go. And then we can respond then at an hour that is good for everyone. And so out of state is certainly another challenge. And that happens, I think in central Illinois, we're a little more protected from that. I know kind of the providers that are on the border, Chicago providers, certainly Northwest Illinois, and then south near St. Louis, Missouri, they have more out of state young people come over, but that can be difficult because we are not allowed to cross state lines with a young person. And so again, it's working with states and providers. And unfortunately, not every state very few states have a similar setup that Illinois has. And so it can be challenging. But, that's when we work with, kind of the bigger entities, I suppose, to connect. And there's so many nuances with, is it a youth who has run away? Is it a youth who, is their concern at home? Because if there's a concern of abuse or neglect or something at home and they're from another state, just trying to navigate that and what all that means. If they've run away because of a delinquent offense, there's just so many different nuances to that. But CCBYS trains us so well in how to respond to all those nuances, and we just work well with each other. Do we have questions?
So yeah, anybody who has a question, you have an invite to be a panelist, just accept it. You'll pop on the screen with us so we can see who you are and answer that question.
I have a question for NRS, our partners at NRS. So if a youth is from out of state, are we able to connect with your Greyhound return home kinds of things ever? How does that work?
Yeah, we can definitely look into that. I mean, we probably would give that caller the number to our 1-800-RUNAWAY hotline, and then we would do a home free. The program is called Home Free. Do an intake for that, and that would definitely be a possibility.
Yeah, and for those that aren't familiar with Home Free, we're celebrating our 30-year partnership with Greyhound this year. And we've partnered with Greyhound so that if a kid is a runaway, not in the custody of a child welfare organization in another state, and not on run from a juvenile justice system, because when those two things happen, we got to work with Interstate Compact to move kids across state lines. But if it is a youth that is not in those systems, our staff are trained to do human trafficking screening to make sure that youth also aren't being trafficked across state lines. And then we work with the youth and an identified caregiver to really ensure that there is a safe and appropriate setting that they're going to. And then in partnership with Greyhound, we can provide a free bus ticket for that youth to cross state lines to get home. And if the youth is under a certain age and or there's concerns about will they get from point A to B, Greyhound also allows us to provide a caregiver ticket. So if Andi needs to get from Illinois to California to pick me up because I'm 12 and I shouldn't be traveling alone, then we can get Andi a ticket to come get me. Or if I'm 16 and there's some concern that I might change my mind along the way or not, or engage in maybe at-risk behavior, again, we can help get a caregiver to the child. And that's where we work with shelters and providers in other states. As Cheris identified, not every state has a CCBYS system, but if there's a shelter system in place, we can work to make sure that kid gets to safety for the night while we work to get the parent there. So we have a database of over 6,000 resources that allow us to connect kids to local shelters and resources, and then work with the organization here in Illinois or in another state to access Home Free if transportation is the barrier for a kid to get home. Okay, so that does answer one of the questions that came in. Does CCBYS ICOY do human trafficking screening? I know I mentioned that for 1-800-RUNAWAY we do. Cheris or Seth, do you have a specific question or specific answer to that question for CCBYS?
We do. We've got about 4 or 5 questions specifically around trafficking, both labor and sex trafficking as well. And so we'll ask those questions, and they're not, you have to be very sensitive with how you ask those questions, and be strategic in how you ask those questions as well, because a lot of young people wouldn't necessarily say or even understand that what's going on is trafficking. They would not identify in that manner. And so being able to ask the questions strategically kind of helps us discover what might really be going on. So yes, we do a human trafficking screening as well as, trauma screening, abuse, neglect screening, suicide, homicide screening. It's anything and everything. We screen for all things. And then based on a young person's response, we may then connect with other partners immediately. So if there's certainly an immediate crisis that needs to be addressed, we'll respond with a crisis team or mental health services, or we'll address some of those answers at follow-up, as all of our CCBUS programs provide follow-up services for all of our young people who've been in crisis.
Thanks, Cheris. So yeah, keep the questions coming. We have another one that asks about home free. Is that for any state? The example being if a youth is from Wyoming but is found in Florida, are they still able to call for a bus ticket? And yes, this is any state. I would say Florida is a great example because often we do get youth that have found themselves in Florida. And this program is for up to 21. So often the home free program is used frequently by kids 18 to 21 who thought maybe I can go find work in Florida and that didn't work out, or they went to a family member in Florida and then that didn't work out. So this program isn't just for youth that have run away, it's also for that 18-year-old who tried to launch themselves towards independence and maybe ended up one of the listen-ins I did was a young man who had lived with grandma most of his life. Grandma was in the hospital. He, thought he could find work in Florida. He ended up in Florida. He ended up being assaulted, was using the adult shelter, which was very scary for him. He then found himself on the streets and was like, I really just want to get home, but I don't have a way to get home. And then we worked with an aunt back in the St. Louis area to help this young man find safety in Florida and find safety back home here in a caregiver. So again, it is available across state lines. Again, it doesn't matter if that youth is 12 or they're 18 or 20, we are still going to do that human trafficking because as Cheris identified, often our youth don't realize that the boyfriend, partner, and sometimes unfortunately a family member that enticed them with work really was part of a bigger criminal organization and victimizing the youth. So, okay.
I have another question. This kind of for Cheris and Seth. What kind of credentials or things are needed to work in the CCBYS program, and what kind of training do workers get?
Seth, you want me to take that or you want to start?
Hey, I can start. Yeah, I can
Great.
speak too. In terms of I can speak on a contractual level. CCBYS is one of the most consistently funded programs, and the contract does not expand a ton because the requirements for someone to hold a CCBYS facility are very specific. So that group across the state is very consistent. It doesn't fluctuate a ton because there's a high value, a high need for programs that are kind of this intermediary between kids in crisis and DCFS, and that's the space that CCBYS carries. One of the specific kind of evaluation process procedures that kind of are facilitated for training is the CBAT-O. And the CBAT-O is a trauma-informed care assessment to assess whether staff who are interacting and engaging with youth are aware and knowledgeable of trauma-informed practices. So this goes from the bus driver to the front desk person to the case manager. How well are your staff, doing in your knowledge of being able to support youth who are in crisis? And outside of that, based on that score, different series of trainings are provided by ICOY and other organizations to support the ongoing development of the trauma-informed practices. And I can let Cheris go into the details of those. But that's kind of an overarching base for what is kind of needed.
Yeah, so in terms of like credentialing as well, so all CCBYS agencies are licensed child welfare facilities, which have a ton of components around that as well. You know, each of you have to have leadership staff that have to have certain credentials, you know, master's level staff. Then you have your direct service workers who are often degreed and have their credentials as well. It doesn't necessarily have to be like a social work degree or a psychology degree in terms of credentials in that aspect. But you do need to be a degreed worker to, you know, be a child welfare worker. And then, you know, a lot of times you have this child welfare license because you are providing shelter. And so you're either providing shelter on site for young people, or you are working with other agencies to provide shelter. Project Oz specifically works with licensed host homes in the state of Illinois, in our community, and those host homes are licensed foster homes through the Department of Children and Family Services. But Project Oz, the CCBYS agency, is the one who is licensing those homes and monitoring those homes. So there's a lot of credentials in terms of, you know, having that specific licensing credential and kind of all those areas too. So as Seth said, it's very rigid and very just specific in what we need to do and how we do that. And it doesn't really change at all. And the training is extensive. And so if you have a CCBYS worker that comes from Project Oz and then goes to work for Midwest Youth Services down in Southern Illinois, that CCBYS worker should be performing the same services as they would have in Project Oz, because we're all trained across the board. There is specific statutes, there's specific response times, the trainings that are provided through ICOY, as well as other runaway and homeless youth programs. There is on-site training, there's on-the-job training. The best training certainly comes from shadowing. And so, you know, every program you're going to work alongside a tenured crisis interventionist, and you're going to go along with that particular person to respond to crises until you're ready to respond to that crisis on your own. And so it's so well performed and so well trained that it's one of the best programs. I know we're all passionate about it here. It's one of my favorite programs, and it's probably why I continue to stay in this work for so long, because of CCBYS.
Yeah, and it highlights just how important safety for the youth is, and ensuring that by entering the system, they're not re-victimized, and that we truly understand how to keep them safe and return them to safety, even here within the state of Illinois. So any other questions or thoughts from this panel? Otherwise, we'll work to start our close. And any last minute questions, feel free to send them. So we will make the slide deck available to those that are registered participants. So again, we'll make sure everyone has access to that. So as we conclude the questions and answer portion of our conversation, I just want to go ahead and make a plug that we're in Youth Hope Month. And if you haven't visited 1-800-RUNAWAY, please do. This is where you will find online resources for upcoming events, including November 13th, which is Wear Green Day. And at this point, we have over 160 partners in 59 states. So we really are 50 states. It was 49, sorry about that. So 160 partners in 50 states, including Washington, D.C. So we're super excited about that. We were able to light up all 50 states in our partners, but we're also hoping to light up all 50 states this month with lighting local landmarks. So there's resources and tools at 1-800-RUNAWAY to do that. You can email us. We have sample templates that we can help you use. A lot of the landmarks, you have to be in the state in which you're wanting to light it up, because NRS is incorporated in Illinois. We don't have the ability to light up something maybe in Memphis, Tennessee. So again, we are welcoming all of our partners to help us really shine a light on youth homelessness this month. We will have another lunch and learn on Thursday, November 20th. So if you haven't registered for that, please do so. And again, on behalf of the National Runaway Safeline and the Family and Youth Service Bureau, I hope this overview of a collaborative system in Illinois has been helpful. And if there are any questions or about the material, if you don't get it, let us know. We'll be sure to send it out. And last plug is make sure you follow us on 1-800-RUNAWAY and get the latest and greatest for Youth Hope Month activities. And one final thank you for Cheris, Seth, Andi, and Brad. Really appreciate you taking time today to be part of the presentation, being such great partners in Illinois for youth in crisis. And we truly look forward to seeing everybody on November 20th. Thanks, guys.
Thank
Thanks,
you.
Amanda. Thanks, everyone.